Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. I am delighted to welcome you to our webinar this afternoon. I'm joined by Dr. Tom Ashfield. Tom, how are you? We're going to get stuck into a really great chat today because there's been so much going on this week. Lord Darcy report is out. It's Sepsis Day today. It's also Friday the 13th. For those who are joining us, if you have a question for myself or Tom about, healthcare, industry, investment, or anything that's going on in the world, please pop it in the chat. Let's start off, Tom, just recapping. This is our fourth webinar that we've held together. Maybe short intro from yourself so we can bring people up to speed.
Well, many thanks. It's good to see everybody here. And yeah, it's a week of huge, massive shifts in understanding of healthcare equity and value. So we're doing it on the right day. My background is as a clinician, as a pharmacist, as a cancer surgery doctor, and then as a GP before entering industry, where I've become invested in policy and economic recovery of health systems through the lens of antibiotic resistance. In short, basically, antibiotic overuse disproves consumptive models of healthcare. So the more you use, actually lose their value. So how do we value outcomes as opposed to pure consumption of materials? And that relates directly to the WIS ethos, I think.
Okay, brilliant, Tom. So just to give people a bit of an impact or a bit of overview from my perspective, I'm involved in healthcare 25 years. I've worked, I was the chief officer of the National Haemophilia Council in Ireland. So I spent about 7 years advising the Minister for Health on all matters relating to haemophilia. Worked in the NHS and have been working internationally in the global health space for a number of years, SDGs, SDG cities, and been a member of Pope Francis' Vatican COVID-19 Commission, for example, looking to the future. Have written numerous papers on the future of healthcare. And I guess myself and Tom, we have this shared vision of empowering people to manage their own health and well-being, because we realize that the health system is under so much pressure at the moment. Hence the reason why, about 9 years ago, I created the World Health Innovation Summit to actually just do that and help people, empower them to manage their own health and well-being, but take pressure off the existing health services. Maybe, Tom, we start there. The Lord Darcy report has just come out, and this has been on the tip of everyone's tongue for the last couple of months. No surprises. We really, the report that's come out basically is saying move care to community, analog to digital, and sick care to prevention. Your thoughts?
Well, actually, the surprise for me is the rapidity of the report. That's incredible. New administration, call for action report within 3 months with actions. So actually, I think there is irrespective of what the content is, this is quite fresh. I'm really glad to see a surgeon that's pioneered revolutions and ideas within the health service to really spearhead this, and also Lord Darcy with the Fleming Centre is spearheading the importance of antimicrobial resistance is one of the key pillars. So for me, very important to see that. As a GP that still practices, essential that people realise that the GPs, we're seeing 90% of the patient mass every single day. And really the call at the moment is for generalism. We need minds of generalism that understand full system, that understand patient journeys with multi-morbidity. And what has been happening is we've iterated to super specialized, wonderful services that people can't access. I think, and this is really understanding that. The other marker here, digital maturity, really what the NHS is yes, broken, but also it's going through an identity transition. That's essentially it. Is it an organization? Is it really a group of organizations in time and space? I think that's what's leading from these kind of reports for the country to say back to it, well, where is the leadership from above, from the sides and within? And I think the main thing about that is getting everybody in partnership. So cohesively, you lead together and have your enablers in industry, non-profits and think tanks around you all fixing it. So, really, really all sharing this together and how we march. And so, yeah, I'm quite optimistic about this. And your thoughts, what do you think of it?
Yeah, no, it's a critical time for the health service. So I think what happens in the UK is almost replicated worldwide, because it's such a leader. It's seen as a pioneer in the healthcare space. So I think this report is, like you say, very fresh, and it's timely. It's happened very quickly. It's been turned around. So the government clearly want to get ahead on this. And I just feel it's such an opportunity. I mean, when we launched World Health Innovation Summit in 2015, the whole idea was to support the health system, to bring a platform which you could have your patients, your clinicians, your managers, the voluntary sector, education, the business community, all working together to support people's health and well-being. So what I'm excited about is the fact that the UK is now making that transition across to the preventative model of healthcare. And we're going to see a shift in terms of the budget, move, like now it's going to move out to the community. I mean, the biggest lesson from COVID was that we engaged well in the community when we went out doing the vaccine program. So let's not retrench. Let's go out there and meet these things head on. I think key for people to understand, if you're listening to this conversation, is really to understand that health is wealth. It's so important that if you're unfit and well, you won't have a job. You won't be able to go to work. And at the moment in the UK, you have 2.5 million people who are out with ill health. And this is what's dragging the economic situation in the UK. So people need to collectively understand that everything revolves around health and wealth. So that's what I hope we can kind of establish over the next couple of months and build a legacy, build a health system that is sustainable. I truly believe that it is. That's the way of the future. And we can create a lot of jobs. You can create a lot of jobs in this space. So that's some of my initial thoughts. I mean, being able to bridge into industry, financing, this morning I just had some meetings with investors, banks. This is groundbreaking. This is a new way of working.
Absolutely. Well, and that I think it's important that you and I clearly portray an optimistic view of the future, because we're futurist in our thinking pattern. And I'm aware that when that's presented to other people, there can be reticence or thinking, well, that can't ever happen because it hasn't ever happened. But what is key in our thinking here is that we need to bring down and understand the foundational elements of healthcare. So to start this conversation around value, there's two topics that I wanted to bring up with you. One is, what does value mean for a patient, a community, a town, a city, a country, and how that changes across the scale? And then how is value seen by the system providing it? So if it's a system-led dictation of value, saying this is what value looks like, how that can be at odds with people there engaging in it. Then the other thing, so that's one thing around value elements, valuation, perception by people and populations and systems. And then the other thing is thinking about the value elements. So to me, I think that this calls for a time of looking at our infrastructural elements of healthcare. And I would say absolutely that you cannot even open a hospital without infection prevention, antibiotics and vaccination strategies. You can't have your immunosuppressive treatment. You can't have your hip replacement, your cardiac surgery. And the focus for too long has been on the very sexy stuff, when in fact it's enabled by these platforms. So one thing I'm championing through my work, and I see that you're doing, is for the health system to focus now on its foundational elements before it builds its digital house. It has to understand its foundational bricks. So from the WHIS point of view and your point of view, Gareth, how are the impact investors thinking about that in the way, because you present it similarly, right?
Yeah. So this doesn't just apply to the UK, it applies around the world. So if you just take the example, what is value? You ask the question to the individual, that's quality of life. Now, what does that mean? For me, for example, I wear a hearing aid. Do you know what I mean? And that's valuable for me because it allows me to hear. But if you look at that from a systems perspective, the NHS has the system in place to give me a hearing aid, right? And that has a supply chain that goes right along the back end. But where we're struggling at the moment is, if you look at the educational situation, it's really down to staffing, recruitment, and retention. And then you've got the whole infrastructure that you're talking about at the back end. How do you facilitate that? And I think there's a realization out there that the industry is beginning, and investors are beginning to look at, right, what is meaningful impact? Okay. In the past, what the way we used to look at it, certainly when I worked in the Department of Health, and you'll be similar, Tom, and is what is the cost, so that's how we measured everything, but there are more factors to be considered. So, keeping people out of hospital, for example, or if someone's in hospital, the average cost is about £800 per day. But if you have people visiting that individual, that's an extra cost, which we never kind of equate. And then there's the mental health implications and so on. So this is a really fascinating conversation. Don't want to overcomplicate things here, but I think we've got to get the basics right. Do you know what I mean? And the fundamentals, around our engagement with local communities. And then ultimately the impact. If you demonstrate your impact, then the investment flows, and I think, but we often are stuck. Like, for example, there's a lot of people who want to do a lot of good work, but they don't know how to even start, or get some seed funding to start their projects. So I think that's what WIS is trying to do, is trying to demonstrate that value across all the sectors. So not just from an educational point of view and the children's programs, but right across to the infrastructure that you said. Like today we were talking about building ports, actually, transport, energy. I mean, I had a call last week with a fund around energy, and energy, is critical. If you've no energy, you can't run a hospital. You can't deliver your vaccines. You can't. So these are sort of like very important discussions.
Yeah, absolutely. So here we're coming back to infrastructure. I will keep talking about this because I've been with academic economists for a couple of months now, and it's been fascinating, really, to think about what value is. So I think that this identity of value is what is at the source of many issues here. And so what's important when we think about impact is areas of value that are valuable for the service, for industry, for other sectors, for NGOs, and for patients and public. So find out those areas of synergy first, because then you can truly build value. Another distinction is, do people have brand loyalty to a health system? Well, it's a bit strange, because actually people want to be well, they want the product from it, but they don't want to be around in the place that's got the name on it, because it means they're unwell. So it's a very, very different industry to others, and that all the time is focusing on look at outcomes. So outcomes are very important. What the NHS has done is understandably it's had to put targets and levels around things that are worsening, but you can't measure growth in things that are broken. So, for example, if we take the waiting list disaster, that's calling for action, but when there's not the tools to change it, then how do you do it? I think more important for me as a clinician is to have a breakdown of that waiting list, and I think that there's a high proportion that others and generalists we could probably look at and probably take 10% off of them tomorrow, off of those lists. So reduce the burdens. The other thing that's really vital to every system is time to appropriate intervention. So it's actually not, I think we focus too much on people trying to understand what's wrong with them, my quest for getting a full picture of what's wrong with me, when in fact the goal and the value in healthcare is the intervention and when you get it. So that's the appropriate person that you saw that then intervened with the right thing to then get you to a function that you wanted, and that the society that sits with society. So yeah, time to appropriate intervention, I feel, for value fits everything. And that really is demarcated by, what is it today? World Sepsis Day. So treating sepsis is probably the most time critical area of mortality in healthcare. So our perceptions of what keeps people well need to probably be understood through a time lens as well, because the interventions of recognizing sepsis and then intervening with fairly simple interventions are valuable within those minutes and hours. And the infrastructure that goes around that is then supremely valuable. That's where the infrastructure lies. But on Wednesday, that stuff is not valuable to that patient's journey at all, because they're not with us. So the time critical nature of some interventions is much higher. And so those need much more of an infrastructural impact understanding than those that are less time sensitive.
Well, that goes down to the elective surgery issue that you mentioned, because if you're waiting on a hip replacement or you're waiting on a knee replacement, for example, you know, if that's put off indefinitely, eventually you're going to have a heart attack, you know, because you're ultimately going to put pressure on your organs, because the strain, you know, on your hip, it'll push a vein, you know, there's things like that that people are just not aware of. So these things are critical, you know. I mean, what's very interesting this week as well, you may have seen the report out on the MSK, which is basically physiotherapy, and using gyms as a way of diverting traffic away from the NHS long term. And I think what's very fascinating here is the fact that we are now beginning to see these grassroots sort of solutions come out. And this is the area which I've been speaking about for, you know, for the last couple of years. This is where the new jobs come from. Do you see what I mean? So this is where the investment flows. All these individuals, we're seeing it across social prescribing, for example, with link workers. There's money pouring into that area. And this is where the opportunity lies. This is what we demonstrated with our proof of concept. You know, Pound invested 36 back. You have a $12 trillion market space. If you look at the opportunity cost there, Tom, that's where you're generating millions of new jobs. It just needs basically the leadership, the funding vehicle, where you bring the investors and you pitch it to them, and you show them how this actually makes an economic return, whether it's in impact or whether it's in a monetary return. And that's basically what WIS is doing at the moment.
Yeah, indeed. I think that what you're showing here is you're allowing an ecosystem for people to hang on. What does their system currently look like? So that's a lot of the thing. Again, to iterate, I think there's been an identity crisis of systems, of trusts, and of healthcare systems. If you think about the Enablement Trust Barometer, I don't know whether you know of this. So Enablement did this analysis of levels of trust out of 39 countries. The UK is actually bottom of that list. So whatever you say, however optimistic we are, we must appreciate that we're in a nadir of trust levels between each other, between systems, and that takes what has to be done there is courageous change. You just have to start trusting. That's the only thing that has to be done, and that takes a leap of actually at the service, at the interface, we start to change the interactions, because it's all very, very well us thinking strategically all the time, but the change happens with the patient in the room. So what the other marker around Darzi within his report says about how, like, retention of staff and wellness. So wellness is in the moment. It's not in the past, it's not in the future, it has to be in the present. So people need stuff that's going to be in the present, and it's going to have to change. So it's not like it was last week. To do that, I think that I see the 1.3 million staff that are employed. I see numerous areas of where we should just buddy up for half an hour of the day, and then become a 3 million approach for a little bit, and then get the triage done, understand that not everybody can always have all the skills. And then I also really think of valuing the people that have got the most experience, of breadth of experience. I say that because I care about it. And I also think that patients know what value is. So they know in front of them if somebody has not got the experience that they need. With increasing levels of complexity, multi-morbidity, polypharmacy, you actually need generalists. Unless you get a generalized view of differentiating the problems, no amount of tech can actually differentiate that well still. Mm-hmm. And it won't, because it will iterate around the best outcomes for every disease, and then it jams up. And that's why there's generalists. So yeah, I think that this value story is one to extend, and I'd love to hear what the people watching here today from their different sectors feel about value and what that actually means.
Well, absolutely. If anyone there has a question for myself and Tom, just please pop it in the chat. But I think let's start with what you discussed there, because you're talking about value, right, for citizens. Okay, so what is value for citizens? Okay, so let's take that one. Okay, from my perspective, if you know, and I'm just giving my perspective here, it's being able to go to work. You know, it's being able to pick up my children if I have a knee injury, for example. Like I can recall years ago, you know, I played a bit of football when I was younger. Not that I was any good at it, but I tried, and you know, but I remember having a discussion with a physician because I had some knee problems around medial ligament, and he remember telling me this. He said, "Gareth, do you want to be able to pick your children up in 10 years? And if you do, you need to stop what you're doing." And that was valuable to me because it made my decision that I should retire. You know, so that's value for me. So if we're just talking about the individual and the citizen.
Brilliant. So very early, I think this is something we can do, and then people will understand. So the value of me having a knee injury, you, my mum, my gran, is going to potentially be different. Where is that most of value and pinch point for society and the individual is actually for the person that's self-employed, that's feeding their family and needs to get an intervention. So how do we fit priorities around that? Because it can't be a one size fits all. Now, what's really important here is you also picked up on something that's been very well mapped and has led the charge in value-based outcomes and investment, and that is orthopedic intervention, because it's very easy to understand from a tariff point of view in any system. And they also pioneered the enhanced recovery programs long before anything else did. So how do we get our patient out on day 1, 2, 3 from their joint replacement, rather than thinking they're in hospital for 7 days, picking up infections, etc. So I think you're absolutely right. Use exemplars of change that happened already, you know, so the pathways to orthopedic intervention is really good. Then you'd understand within a system that the value is not about getting to the triage system. So if I then refer a patient at the moment with hip pain, and then there's a 6-month wait for them to go to an MSK triage, there is zero value in that wait time. There is a burden on the system because there's waiting, there's a burden on the patient, it doesn't derive value. So actually, I think much earlier, devolving to the patient, what are your expected outcomes? What would you like from this? And I think we could very early iterate getting them direct to imaging sooner. So actually getting them imaging will be the key thing there. And that's where you can have an investment story.
Yeah, so that's great, because we've given that one example on citizens, right? Now if we take this from a community perspective, now this is really important. And this is where everyone needs to just pay a little bit of attention here, because this is also around where decisions are made, where you set up companies, okay? And you decide what makes it desirable to set up near Oxford or Cambridge, for example. Well, I'm going to go down there because there's a lot of intellectual property down there. There's a lot of intellectual capital. And basically there's people who have good minds, and they're congregating around there. So let's set our business up there, which makes it easy for investors to invest in that. Now, the same applies. So this is probably the reason why the North here in the UK struggles to attract foreign direct investment, because you have a lot of ill health, right? So employers know I'm not going to be able to staff those jobs, right? Because people are going to be sick and unwell. So I'm not going to make my return on investment. Sure. So I think this is where the community aspect, this is where like what WIS is trying to revolutionize, shall we say, in the cities. So we're going to deploy our solutions in cities so that we can attract foreign direct investment for projects. So that's sort of the idea. Is your thoughts on that one? Because that's really critical.
Well, I'm going to pull them through on this, say the knee injury for intervention, with exemplars. So the leading charge in value-based healthcare, so that's looking at values rather than necessarily what's consumed and what's done, looking at what's the value of the intervention and the outcome, was worked up by Swedish health system and actually done on a community basis, and then tendered to providers to see how you can reach that. what I think we've tried to do in this country is realize is commission for a service, and what's happened is that service is crossing geographic boundaries that is great as well, but you've ended up with patients from metropolitan areas traveling to other metropolitan areas and then having hotel expenses for something that's a day surgery. So it's actually been creating value, it's creating cost through the lens of intervention. Whereas the Swedish model that looked at this actually built it from the community. So say in Bristol, where I am, how do you actually build this knee pain, return to your occupation, your function, as the thing, and then the providers around that working around the value-based outcomes. So there we go, that's scalable. And then at some point, we've got this tipping point, which shows the identity issue with the NHS as an organization. At which point do you let go of regionalized, devolved care, and which parts of it do you have for national leadership? And that's I think that's the thing that's being begged for me from the government administration, to say, well, which part is now yours to lead the charge on, which is localized. So yeah, I think in terms of your view on that, is there any examples you've had of community intervention that look at that level, and then you've reached a scaling issue of going, okay, well, how do we scale this to 2 cities now?
Well, I mean, I can just go back to the time when I worked in policy and with the haemophilia groups, and I give you a brilliant example where we moved factor concentrate, which was the drug vials that we used to send to people's homes. We used to know through technology that it was going out of date. It's very expensive product, so we've sent a van out, collected the product, and brought it to the hospital so it didn't go out of date. And I remember we produced a report to the minister. We saved 2 million annually, and then we decided, well, we'll scale that program up. We'll do that. We did a spoken hub with the blood transfusion service, where we had the hemovigilance officers bring the product back in, and so that was stock rotation. But you can apply that to any community. What fascinated me was the fact when I left haemophilia and I was leaving that area, that this wasn't applied across the service, because we have the silo thinking. What I wanted to kind of just touch on, just as a next step, was that investment. So we've covered citizens, communities, investment, and this is touched on your point where you made about being a generalist. So my advice, anyone watching this, share this and interact. But everyone should have be a little bit of a generalist. When it comes to investment, because we need to understand where money capital flows, how does it work? I mean, I've started to discuss this with, I've moved from moving from health sector into the investment world, financial world. And I've found that it's very receptive, and I'm learning so much. Do you know what I mean? Just by making the effort to go and understand how investment works and how it flows. And the investment world is looking to come in the other way, because they realize, I think we all realize that we have to change the way we're doing things. I think everyone out there, anyone watching this video, will say it's not working and we need a fresh approach. And there's so many people who are struggling. And if you go to any of the investment conferences, there's loads of money there. There's loads of capital, loads of savings. Sovereign wealth funds are bursting. Family offices are bursting. But we have a disconnect between local communities and ambition. This goes back to your point that you mentioned about trust, and people say, oh, that's not possible. Well, it is possible. I mean, look what Elon Musk is doing in terms of going to Mars. It can be done. You just have to have the vision, and you have to get up and go to do it. So, I kind of put to the audience, get involved, and ask questions about, I mean, you've just seen the value just today, actually. Coal mine in Cumbria, for example, the High Court has thrown out the application, and a lot of people will be saying, well, there's 500 jobs gone there, but actually there's probably a lot more jobs that will flow in, because that sends them, investors are not investing in coal anymore. They're looking for clean, net zero, renewable energy. Nothing to stop those jobs going out to West Cumbria if you have the vision, and you will get a lot more investment going into that area. So, and again, of course, they have implications on your health and well-being.
Yeah, absolutely. So thinking about this to firstly, picking up on generalism. So generalism does not mean that you don't have expertise as well. This is the common thing that I think that people think is that, I mean, I've had so many hats, and I do wear many hats still, and that's absolutely to be celebrated, and actually to not judge why people have done this. And so I have deep expertise on policy reform with antimicrobial resistance, within understanding value models around that. I also have deep expertise on every single medicine that's dispensed every day in every pharmacy. I could write half a page at least on every single one, and probably on about 100 conditions. That doesn't mean to say that I can't, go and do something else. And it also means that for people, because I'm not the only one like this, there's loads of us. But what my peers are doing is leaving to another shore. Now that has to be faced. Now what's then going to happen is you're going to get a brain drain from another country that needs those people, and they're going to come in to here in it without legacy understanding, not their fault, of what the system has been through. So we need the pioneers of change to remain here, and for it to remain attractive to people, that we don't cause a brain drain. And that's really very important, because that's investable. Like you said, the thought leadership of and the capital of why you'd go and live around those university cities is for that very reason. And the world still knows we are this. The UK definitely has all of this. We're pioneers and brilliant places to invest in thought leadership. What is risky for us is the high levels of regulation that are involved. When you have high levels of regulation, particularly in healthcare at face-to-face, it dilutes your time to have compassion. It doesn't dilute your compassion. It dilutes the time that you can deliver compassionate, meaningful care. So it's at odds with the outcome. So I think we need a very, very clear understanding of that. Bringing it now to investment. Investors, impact investors particularly, need a holistic understanding of why they're investing in something, to understand the holistic impacts. And at the moment, we must appreciate that this must be tethered to improvements in our environment, our ecology, our biosecurity, our water and productivity, and our healthcare. So it's not a one-trick vertical aid issue at all. So if we think through a vertical venture model, that will basically lead to some tragedies of other areas if we only vertically aid some things, and there's multiple models of that. So I think, from what I've understood in being in those circles and being able to translate the system, is that we need to say, like WHIS is doing, and your work clearly is explaining how you can holistically benefit those things, understand the risks entailed with doing it, which are very real, and how can you mitigate those externalities, those risks. And that's what I think WHIS is doing, and that's why you are heard by investors, because you understand those areas.
Yeah, and I think also, so you talk about the risks, and this leads us very nicely into industry, the sort of like final pillar of our discussion today. But I think it's also about, we are very risk averse within the health sector, but we have to recognize, and even with the Lord Darcy report, this is an opportunity now, and even from the point of view of becoming, like, I sat as a public sector worker for 15 years, my role was always protect the state, protect the NHS or the health institution. But now it's about topic of conversation, enablement. Do you know what I mean? Now it's about like the leadership, the thought leadership, to empower and to actually not just say these things, but to do them. So it's great having the ideas. It's like the old saying, a great idea, brilliant, but how? How do we actually execute? I mean, only a couple of months ago, I was, in Helsinki, working with the Finnish government, invited across, and they were asking, like, how do you execute the future of healthcare? And we have a model that works. That's the beauty about this. And what's really exciting is, just before we came on, Tom, we were talking, having the opportunity now to speak to investors and to actually show that there's a vision here where we can, basically provide healthcare to millions and billions of people around the world. We just need the capital, right? That's all we need now. And that's we, the hearts and the minds, we know we have to do it. That argument is done. Now we just have to bring the capital. And that's we have the people, we have the expertise, we have the knowledge. So let's go do it. Now it's about the action.
Yeah, I mean, indeed. And we're thinking about sort of endowment approaches. And if we were to think about this as a house, of going in to buy a house with a partner or a group of people, it's not just me asking what the other person is bringing to it. It's them wanting to know what I have as well. So identifying also that the system is a massive holder of capital as well. Yeah, I think that's the other thing, and what's being done with that capital, social, intellectual, and economic. So the very important thing to understand is where the money is actually going in terms of the house of cards and this hierarchy of needs. So the paper that's just been accepted is something I'm passionate about, is the enablement of high value procedures. So if we think about immunosuppression as a whole, that's increasing. Invasive procedures, they're increasing. So, but they sit on a very, very fragile platform of infection. For example, we talked about the knee surgery. Say we'll have a knee replacement now. The cost of having a prosthetic joint infection, if that is then infected after your surgery, is £100,000. There are many around the country right now. So the value of preventing surgical site infection, which is something I'm passionate about, is so incredibly valuable that if you improved that by 1%, you'd have such massive impact. And then realizing the enablement and the downstream impacts of that care. And so our valuation models need to definitely include enablement. I think very quickly we need to bring in due diligence of immunosuppression and invasive behaviors into the patient conversation, into the system conversation, and also in terms of our interventions, because then you realize the value of them. And this, again, perfect for an infrastructure building up. Impact investors understand economic infrastructure and how you invest in that to maintain and grow your house. What's happened at the moment is we've put things on the top and the penthouse suite that we're delivering brilliantly well and bringing into these healthcare institutions, but there's other areas that you can't then deliver because the foundations are creaking and the whole thing could just fall down. Yeah, so there you go. So you've understood it from this, is that when you speak to systems, is you go, well, how do you invest in infrastructure, the social capital of that, and people's understanding, valuing their health and preservation and conservation of health is actually the key part of the investment here, because it's the consistent thing.
I think also what's important for people to understand, because a lot of people take it from an individual's perspective. Okay, so, but just pause for a second, because when you look at the general population health and communities aspect, so it's very hard for people to understand, well, 7 million people. Try to concept. No one's ever seen 7 million people in one area. So how can you possibly?
Oasis will next July.
yeah, but that's, that's the point. What I'm saying is very difficult for people to understand how many people that is. I used to work in the department on our elective surgery. The National Treatment Purchase Program we had, and you see 60,000 people waiting, or whatever. There's thousands. That's an individual who has a family. It's hard sitting in an office and you realize you're talking, these are just numbers. No, they're not numbers, they're people. And then I think if you peel it back, and this is where the opportunity is, this is what I'm talking about, the risk and the opportunity. You're talking about millions of people, and worldwide it's billions of people. 3.5 billion people do not have access to healthcare. We in the UK are very fortunate. In Europe, we're fortunate. We can go and see a doctor. The infrastructure that you mentioned, Tom, is there. In lower middle income countries, it does not exist at all. So there is an opportunity there to leapfrog from a legacy perspective, to move forward quite quickly through digital, and to embed this new model of healthcare that actually supersedes it and becomes sustainable, but at the same time takes the best of what we have, because we are very good at trauma. There's certain areas that the medical services provide are just amazing, but we have to be honest and we have to consolidate what we have to maintain it and not stretch it too far. Because if we stretch those clinical services too far, I mean, I can give you the example. You can't have cancer treatment centers in every locality. It just doesn't work. You need the expertise in a specialized center. And that's what we were part of reconfiguring in Ireland years ago. That model is there around value. So I'm very optimistic. We're slightly run over today, like we're running over. But if anyone has any questions they want to put to me and Tom before we log off, because we should do a short summary, Tom, and then we've got one more. We're going to do one more webinar on mental health, which we need to fix. But from your perspective, Lord Darcy report, Sepsis Day, and the future. What's for you over the next couple of months as well, Tom?
Yeah, great. No, it's really interesting to arrive at this week. I think stewarding effective and appropriate interventions is the highest value, and prioritizing those, reflecting on what you've just said around the global situation. And actually what we can do is understand that the infrastructural elements are exactly the same wherever it is. So and then we can have a lens of understanding where some places that we are maybe in our judgment saying that they're not working actually are doing things better than what we think are established systems that are doing it well. So there is actually a diversity of practice, and you use the word leapfrog really wise there, because there's no point in iterating the checkbook again. Hey, it's really important that. So understanding from my perspective of the current issue, brought into absolute focus by World Sepsis Day and the Lord Darcy report on the broken UK health system, is calling at a time now to start prioritizing what does value look like. So I actually hope that this webinar has brought up more questions than it's answered, because we have to have now a reflective conversation, hold back, a bit less is more. No apps under our noses for a month saying this is going to fix it, because they're not. Really appreciate that some will as well. And that's not through being, not through being pessimistic to innovation, quite the opposite. But if we don't get the architecture of change right, then we could end up, we probably will end up down a hole again. So bring it back again, investable foundations, using language as well, lesson for me as well, this is the whole society. Everybody in industry is also a patient. Everybody in the government's also a patient, related to the stories that are relevant to you today. And then you'll understand for you what value means to you in healthcare for you and your family, and build up from there. Start at the individual level of what value looks like, and then build that into your interactions with healthcare as well. And from your perspective, what are the next steps for Wiz? Because you've had a whistle-stop tour of the of the world in the last 3 months.
But I wanted to talk about just the final part from my perspective, and just touch on the next couple of weeks, because obviously UNGA's coming around the corner, and there's a lot of events and activities, and we're gearing up towards our online event in November. Just this week, actually, I'll make an announcement, but we've got some colleges and universities that are going to engage with us. So, a couple of thousand students are going to come online and watch the event in November that we have, which is very exciting. And of course, the interactions with investors and impact investors, and looking to scale our programs around the world and cities. The cities program is actually very exciting at the moment. But I just the final point I wanted to make, because it's really around the architecture, like you were saying, and the infrastructure, shall we say. But that all goes down to the mindset. So that we have to start with our mindset. Like, first and foremost, you got to change the mindset and the perception and what is possible. Do you know what I mean? So what can we do together? And you'll find we can pretty much do anything we want once we put our minds together. So that's what's critical for me. But it's got to, people have to understand that it takes hard work. Like it is a lot of hard work, and you have to put the work in first sometimes before you get the reward. So that really is, and that people need to understand that you can't, it's not like the digital age that we have, that you just, you know, these things happen overnight. They just take a lot of time. And that's actually the beauty of the projects that we're working on, because they take time. So you get great, you know, you get a great feeling when you actually deliver them.
Yeah, I mean, iterate, exactly. And that is a message really for digital transformation and AI, is iterate the best human model you've got for it to learn. And I know this is people are doing the education, but if it teaches the system through a clinical risk lens and a negligence lens, it will only be a race to the bottom of then risk-based care for an individualization of problems rather than holism, which is actually the investable thing. So really that architecture to understand what value, where are the common places that people sit together. So where, you know, where do I sit in the Venn diagram with you and WHIS, and where does the investor sit, and then the industrial solution, and then we form that model to see where the synergy is across all of them. And they'll probably be the most investable. I suggest to do that, everyone needs to come up with a priority list of what they feel is the most important thing for them.
Well, I hope people have enjoyed the conversation. Look, you know, a couple of points from me, final points before Tom, you could have a last word there as well. Just what I really pulled out of this, you mentioned it, is about building the trust as well. So, you know, trust, oil of the future. Really believe in that. You've got to trust people, and you've got to allow people to just crack on. And we have to change our mindset in that perspective as well. And that takes a lot at the moment, because we're in a challenge.
You only have to do it one person at a time, though. You don't have to trust a whole group of people. You do it's one person at a time, and it's actually not as hard as people think.
Exactly.
If you do GP clinic in the morning, you'll understand that it's not that hard. It's how are you and how are you feeling and what needs to be done. And
exactly. No, I totally agree. So look, we'll sign off, because we've gone a little bit longer than scheduled, and but it's been a fascinating discussion, and I think that's the reason why we've overstretched slightly. But Tom, look, we'll be back on. Look, we'll be back online. This is our fourth webinar that we've held this year. We're going to do one more, which is around mental health.
Yes.
So look, very excited to have another conversation with yourself. For those who've tuned in or you're watching this on recording, thanks for taking time out of your day to listen to us. Any questions, or you want to get in touch, if you want to see the work that we're doing, Tom, from your perspective, how did they get in touch with you?
Just through probably LinkedIn, or on my email address linked to it, drashfield@gmail.com.
Okay.
Yeah, I'd be happy to talk about anything related to this and value-based outcomes. Surgical site infections, particularly at the moment, I think these are the high-end things that we can do something about quite quickly. So yeah, I'm interested in high-impact things and how we get them changed quickly. So yeah.
Okay, brilliant, Tom. And from myself and my perspective, just check everything out on www.wis.world and use the hashtag WIS, WHIS. So thanks, Tom. We'll sign off. Have a great weekend, everyone, and we'll talk very, very soon. Thanks, everyone.
Good weekend, everyone.